I wasn't diagnosed with hemophilia B until I was 22 years old in 1983. That diagnosis came when a family member had a medical emergency and we realized that he had hemophilia B and needed emergency treatment. Once he was diagnosed, many members of the family were stunned to learn that we also had hemophilia. For me, the diagnosis finally made sense. I had many signs leading up to it. I had nosebleeds, ankle bleeds, several other joint bleeds. I had a wisdom tooth extracted and bled to the point of unconsciousness. There was a ton of stuff, but I lived in a small town in a different time, and nobody had ever put the pieces together. When I was first diagnosed, the treatment landscape was very different than it is now. I was on a plasma-derived product, and I contracted hepatitis C from that. When newer treatments came along, I talked to my doctor and tried one, but it didn't work for me. I lead a busy life, and my goals for treatment are clear. I need to stop a bleed and have a plan for future bleeds. I spend most of my spare time as a volunteer firefighter and an EMT, and I've delivered a couple of babies. I have some CPR saves, and I think it's just about the coolest thing anybody could do. My other hobby is that I am an amateur race car driver and a certified instructor in high performance driving, and I enjoy taking my Corvette out to the racetrack. My philosophy when it comes to bleeds is just like that of driving my race car or going into a burning building. Always be prepared. I like staying up to date and doing my own research, and I'm always on the lookout for new products with a longer half-life. When I read about ALPROLIX, I liked what I learned, so I reached out to my doctor about it. She did the research also and decided it would be a good fit for me. Before I started ALPROLIX, my doctor and I went through a list of potential side effects, including allergic reactions, headaches, abnormal sensations in the mouth, and pain in your side with blood in your urine. This has been my experience, but everyone's experience is different. I'm so glad to say that ALPROLIX has worked very well for me. I've had several shoulder surgeries, and we always treat ahead of time. The same thing goes for dental procedures or anything else that could cause a bleed. If I could sum up my feelings about ALPROLIX in one word, it would be fantastic. My healthcare team is happy, and I'm very happy. For anyone who's apprehensive about their current treatment or not happy with where they are, be your own advocate. Tell your doctor if you're not happy. It may be a difficult conversation, but your doctor wants you to be well, and the right treatment is a big part of that. I'm being compensated to tell you my story.
Indication: ALPROLIX Coagulation Factor IX Recombinant Fc fusion protein is an injectable medicine that is used to help control and prevent bleeding in people with hemophilia B. Hemophilia B is also called congenital factor IX deficiency. Your healthcare provider may give you ALPROLIX when you have surgery. Important safety information: do not use ALPROLIX if you are allergic to ALPROLIX or any of the other ingredients in ALPROLIX. Tell your healthcare provider if you have or have had any medical problems, take any medicines, including prescription and non-prescription medicines, supplements, or herbal medicines, have any allergies and all your medical conditions, including if you are pregnant or planning to become pregnant, are breastfeeding, or have been told you have inhibitors, antibodies, to factor IX. Common side effects of ALPROLIX include headache, abnormal sensation in the mouth, and pain in your side with blood in your urine, which may be a sign of clot formation in the urinary collecting system. Allergic reactions may occur with ALPROLIX. Call your healthcare provider or get emergency treatment right away if you have any of the following symptoms: hives, chest tightness, wheezing, difficulty breathing, or swelling of the face. Redness to the skin at the injection site may also occur. ALPROLIX may increase the risk of formation of abnormal blood clots in your body, especially if you have risk factors for developing blood clots. Call your healthcare provider or seek emergency care if you have symptoms of a possible abnormal blood clot, which may include chest pain, difficulty breathing, unexpected swelling of an arm or leg with or without pain or tenderness. Your body can also make antibodies called inhibitors against ALPROLIX, which may stop ALPROLIX from working properly. These are not all of the possible side effects of ALPROLIX. Talk to your healthcare provider right away about any side effect that bothers you or does not go away, or if bleeding is not controlled using ALPROLIX.